People think that you could only get scarred liver or cirrhosis if you drink alcohol, but the reality is that you could actually get something called fatty liver disease that could develop into scarring of the liver, in which you require a transplant to live. Unfortunately, this happens to a lot of patients. I had a patient a couple months ago. She was the sweetest 45-year-old, but unfortunately, she ended up having cirrhosis because of fatty liver disease. Not every person who has obesity or has diabetes will get fatty liver disease. Sometimes it's just the luck of the draw. But unfortunately, a lot of people don't even know they have it. So they continue with their obesity until their scarring gets worse and worse. And ultimately, what happens is they get cirrhosis. And at that point, they need a transplant to be able to live. Because what happens with cirrhosis is that your liver is not doing its job, is not able to get rid of all the toxins accumulation in your blood, and eventually you could have multiple different complications of cirrhosis. You could have confusion, you could have ascites, you could have infection in the stomach, you could have bleeding. Ultimately, if you don't have a functional liver, you're not able to metabolize your toxins, and that could cause issues. So you need a liver transplant. Fortunately for this patient, she was on the transplant list and ultimately did get a transplant and she was able to live. But I see a lot of patients who are much older who do not get a liver transplant and they end up passing away from cirrhosis. So here's the good news. If you notice that you have obesity, make sure you get your labs checked. But even if your labs come clean, you could still have fatty liver disease. The best test is to do a ultrasound that's specific for fatty liver disease. But in general, one of the things that you could do to prevent fatty liver disease is to make sure that if you do have diabetes, do everything you can to control your diabetes. If you have obesity, make sure you follow a calorie restrictive diet. Make sure you're eating healthy foods, get rid of ultra processed foods, make sure you follow a high protein diet. And the best thing of all is to start doing resistance training 3 times a week or 4 times a week for up to 30 minutes could help prevent fatty liver disease. Let me know if you have any questions and follow for more tips like this.